Roselle. After 43 years of practice and over 1 million patient visits, the Roselle Center for Healing knows what works and knows how you can take control of your health and wellness. My team of doctors practice 21st century integrative medicine. Whether you suffer from chronic pain and fatigue, allergies or headaches, we can help. Take charge of your health before it's too late. Make an appointment today. Call 703-698-7117 or visit online at rosellecare.com. That's rosellecare.com. By now, we all know the number one cause of chronic and intractable health conditions is inflammation. Inflammation causes a decreased immune response that can lead to cancer, cardiovascular disease, insulin resistance, and degenerative loss of muscle and bone. But did you know the number one cause of chronic inflammation is lack of sleep? Multiple studies have concluded that stress, short sleep cycles, hormone imbalance, low blood sugar, chronic pain, and environmental issues like ambient light cause most sleep disturbances. However, according to a recent study, natural sleep at the same time every night is the secret to restoring health and increasing longevity. So what can you do? Sleep in a black, cool room. Don't drink any liquids for an hour before bedtime. Eat small amounts of protein before retiring. Cover your digital clock and never go to bed hungry.
This health tip was brought to you by the Roselle Center for Healing. To learn more or to schedule a consultation, call 703-698-7117 or visit rosellecare.com.
Are you dental phobic? Do you neglect your dental health because of fear and anxiety? A beautiful smile begins with exceptional dental care, and you can trust in the expertise of Soft Touch Dental Care and Dr. Michael Chung. Soft Touch Dental Care is unlike any dentist office you'll ever experience. Their warm and welcoming environment is designed to soothe fears and anxiety the moment you arrive, and they're especially pleased to pamper their honored guest patients. Dr. Michael Chung is a professional and leading expert in all areas of comprehensive dentistry, including cosmetic, sedation, neuromuscular, TMJ, and implant dentistry. Offering state-of-the-art technology, Dr. Chung can give you the smile of your dreams. Arrange for a complimentary consultation today with Dr. Michael Chung and experience the expertise that makes Dr. Michael Chung so unique. Call 703-319-6990. That's 703-319-6990. Or visit bestinsmile.com. That's bestinsmile.com. Educate, engage, empower. Take control of your health with Dr. Tom Roselle and the Roselle Center for Healing. Information is power. Achieve an ultimate state of wellness with Dr. Tom Roselle's Education Lecture Series Video on Demand. Discover how to create an extraordinary life of optimal health and wellness. Visit drtomroselle.com/education. That's drtomroselle.com/education.
Breathe clean filtered air with an Air Tamer Personal Air Purifier. It's easy to have filtered air with an Air Tamer Personal Air Purifier. An Air Tamer Personal Air Purifier emits healthy negative ions to push airborne pollutants away from your breathing space. It's purified air wherever you go. The Air Tamer Personal Air Purifier reduces viruses by 99% within 20 minutes. Go to drtomroselle.com/products to get an Air Tamer Personal Air Purifier. For a limited time, use the coupon code Roselle and get a 20% discount and free shipping. Order today.
Breast cancer is a major health risk to all women. It can silently grow uninterrupted for years. The Thermography Centers of Fairfax reminds all women to conduct monthly and annual breast exams. Consider a thermography scan from the Thermography Centers as an adjunct to your routine breast exams. Digital infrared thermal imaging is safe and non-invasive. For more information and to schedule an appointment, call 703-520-7591 or visit thermographycenters.com.
This is Dr. Tom Roselle, author of Ageless Health. Health is a do-it-yourself program. My book, now also available in audio version, is a step-by-step program of how to take control of your health and wellness without drugs or needless surgery. You have the capacity to change your health and level of well-being. Take control of your health today and order Health is a do-it-yourself program.
For more information and to order, please visit agelesshealthbook.com. That's agelesshealthbook.com.
Are you suffering from flu-like symptoms? Get relief from muscle and body aches, headache, chills and fever, cough and congestion with Oleander 4X. Oleander 4X, made from oleander extract, is a tincture that provides relief for flu-like symptoms. Get relief with Oleander 4X. Go to drtomroselle.com/products to get Oleander 4X today. For a limited time, use the coupon code AgelessHealth and get a 10% discount. Order today.
The information provided on Dr. Tom Roselle Live by Dr. Tom Roselle, D.C., interview guests, show co-hosts, or substitute hosts is not intended or implied to be a substitute for professional medical advice, diagnosis, or treatment. It is for general information purposes only. Information from this broadcast should not replace the appropriate consultation and examination process by a licensed physician. Always consult your own physician prior to changing any current medical directive or prescription.
Hey everybody, welcome to Ageless Health Livestream. Glad you're here with me. Got an interesting program today. We're going to talk about the psychological impact of back pain and your emotions and your back pain. And I'm going to kind of turn a light on some things that you may not have thought about. And I want you to really understand that sometimes when you can't get rid of a problem, there's something that's deeper. See, the body has the capacity to resolve virtually anything. And we know that structural, neurological irritations and biochemical, biological irritations and emotions work hand in glove, if you will, as they affect you. So we're going to talk about that. Think about, for a minute, something that just never seems to go away, no matter what you do about it. Back pain is one of those nagging, ongoing, lousy presentations. On the 14th of this month at the Roselle Center for Healing in Fairfax, Dr. Harlan Browning and I, the professor, are going to do an evening on low back problems and really what happens with them, but how you can fix them. And that's the more important thing. How many of you take a look at your lives and realize that you've limited anything that you can do, your experiences, things that you'd love to get involved in, supposedly, if you will, and you just don't. And maybe, you've tried everything that you possibly can, and you're taking tons of medications, and you're taking, every muscle relaxant and anti-inflammatory and gabapentin and all those things, right? And nothing works. You're still infirm. You can't move. You can't get around too easily. You're in chronic discomfort and pain. You have that lousy feeling in your legs. They feel like you're walking on, socks with tingling throughout your whole body. Is that uncommon? Unfortunately, it's not. And you have to understand that there may be something else that's contributing to it. And what we're going to talk about is that thing that we don't want to talk about, that emotional platform, that underlying trigger that we just kind of set aside. And well, let's get into it just a little bit, because I really want you to understand the role of emotions and the emotional connection. If you were just listening to me on Dr. Tom Roselle Live on WMAL 105.9 in the Washington metropolitan area, we're just kind of going into the next piece of this, because I want to show you some things that is the real emotional biochemical connections and how that works. But chronic low back pain can affect everything. It can affect your mood. It can affect your sleep cycle, anxiety patterns, and depression, and so forth and so on. It seems to be always there. And, pretty soon it can be a catastrophe. What do I mean by that? It means it gets so bad that everything in your life is no longer worth living. And truly, I've seen patients in over 47 years of practice that walk into my office and say, I don't know if it's worth living anymore because I have no life. I'm in pain all the time. Nothing seems to resolve it, alter it, make it any better. But, I don't know. You're my last hope. Is there anything that you can do to help me out? Well, the short answer is if the patient wants to dig a little bit outside the physical capacity, we're not talking about going and getting, 10 years of counseling with a psychologist or taking mind-altering drugs and, all of these psychological drugs. Remember that you have to look at the decision processing that we make as human beings, what we accept as true. And so sometimes, we have to have an excuse for not doing what we do. We're supposed to get involved with a group of people and go for a hike, or we want to play a little tennis, or we want to go out and and get involved in a dance class. But somewhere in our brain, we were told that we're never really any good at anything, so we don't want to embarrass ourselves. So we have to come up with a reason why we won't try, right? Well, that reason that we won't try often is that back pain. I can't do that because I'll really hurt myself if I get involved in those things. So even symptoms that should be modifiable aren't. And there's often major reasons that take place. So we're going to talk a little bit about that. I'm going to show you the neurotransmitters that are involved. And so get that you have an out on this. You can turn things around. But for most people, low back pain is just kind of a minor annoyance that emerges once in a while. And it can be treated either with exercise and stretching, or if it's a little bit more, your spine's out of position, you hurt yourself, you fell, or you've been in a bad postural pattern, repetitively over and over again. So we structurally will help you get back to a neutral position and allow your tissue to heal, get the swelling down, upregulate the strength, and so forth. But when back pain becomes chronic, and that it goes far beyond the physical senses, if you will, it can impact your emotions. So it can go from the physical piece to the emotional piece, or in many cases, it can go from the emotional piece to the physical piece. When you look at the body, and we know this an actual scientific fact, every part of the body has a vibrational wavelength that can be then associated with different types of emotional states. For example, we'll go up a little higher in the body. The heart is the place of love. It's the seed of appreciation, if you will. Love of yourself, love of others, love of a child's smile, a beautiful day. That reflects here. When you get into the lower part of your body, into the abdomen, that has to do with your feelings, your emotions. And if that area is not working the way it's supposed to, your feelings are all going to be messed up. But guess what? There are nerves and lymphatic channels that go where? Directly to the low back. And you can get all kinds of things done with your low back, but it doesn't ever seem to want to stay stable. It doesn't ever seem to want to completely go away. And unless we deal with that, we end up with all kinds of problems. Now, there's neurotransmitters that come from that area of the body as well. And I'm going to show you what those are in just a second. We're going to go through that. I'm going to show you how they affect you. Now, we're talking about this beautifully intimate, interrelated platform called your mind, your nervous system, and your biochemistry. And they're all together. You can't set aside one over the other. You just can't. They are a piece of the same puzzle. So when you have low back pain, let's go from the structural point of view. The nerves come out of your low back, and they go different places. They go in your legs, they go to your big toe, and they go to all the areas of reproduction, ovaries and uterus and testicles and penis and so forth. And they go to the buttocks muscles, and they go inside into the other organ systems as well. Now, each one of these guys have an emotional trigger, if you will. So the lower intestinal tract, you have this, it's like an apron that goes over your intestinal system. It's called the mesenteria, or the mesenteric apron. And that's feelings. That's deep embedded feelings. You go a little lower into the body, and guess what you got? You've got certainty, your ability to do things. So if you don't have certainty, if you don't have the capacity, could you in fact make it impossible for you to even try to attempt to do something? Like, you have low back pain, so I just can't get it done. I can't go out and do anything. God forbid, back pain would stop you from engaging with your significant other, with your husband, with your wife. You can't be intimate because there's something inside of you that now that emotional piece pushes away. Could it cause back pain? Indeed, it could. Absolutely, positively, without doubt, it can cause back problems. So when we start picking it apart, when we start looking at the different pieces that might be associated with it, now we have, these neurotransmitters, if you will. Okay, neurotransmitters are these little, if you will, made up of amino acids that cause the body to do certain things. It'll allow it to be motivated to do certain things. It'll cause it to go into depression. It'll cause it to go into anxiety. And we have a whole bunch of those guys. And I'm going to show you a chart that will represent that. It's kind of convoluted, but I'm going to kind of pick it apart and just make it simple for all of us to understand. It took me forever to even begin to learn it and memorize it, but I got it done. It took me years. But I want you to understand that when you hear the terms dopamine, when you hear the terms serotonin, when you hear the terms GABA or cortisol or any of those things, all of those guys are produced in the lower abdominal area. And it's produced by your good guys, your microbiome, if you will. But if you have bad triggering mechanisms that you react to something, pretty soon that system gets altered and it becomes very obnoxious, if you will, to the system. It feeds back in itself. So let me show you how complicated it can get. And so I don't know how well you can see this, but we'll talk about it. So there's reflexive patterns all over the body from the skull, and they hook up to different parts of the body and produce different neurotransmitters throughout the whole system. But when we're looking at this whole chart, see we GABA and serotonin, and that goes all the way down to melatonin. These things can be disrupted, if you will, and cause huge amounts of anxiety and depression and so forth. Now, we're going to stick to this side of the puzzle just a little bit. GABA is a down regulator. It relaxes the body. If GABA levels aren't adequate, you can't go into that relaxation mode. So you have to make sure that those are working well, but for some people, they can't. When we get a hyperactive child, when we get a hyperactive adult, sometimes it's a dysregulation of GABA, and it may have to do with zinc and vitamin B6 and magnesium and so forth. Now, serotonin, that feel-good juice, that happy juice, that has to do with its own pathways as well. And then we get down into, the relaxation pieces and so forth. Now, the other piece is dopamine. Dopamine's on this side. And we're looking at dopamine is your motivator. It's your willingness to do things. But when you're in a state of anxiety, oh my God, oh my God, oh my God, that type of thing, these chemistries, these are basic pathways. These are just the basic ones. Your body goes into a state of chronic, ongoing stress, but also depletion and causing some of that back pain to show up. Why? So with GABA, if you will, then we're going to go into adrenal function. These are just nutrients that seem to help, like ashwagandha, manganese, passion flower, taurine, L-theanine, valeria. They all help regulate GABA and bring things under control. And your dopamine pathways, we're talking about that. Again, these are words. I don't expect you to memorize them. I just expect you to hear them. And so at a later time, things work out a little bit better for you. But all these plates in your head, in the skull, they all have triggering mechanisms to emotions as well. Interesting, right? So what I want you to understand is that emotions can cause pain, and pain can cause emotions on an ongoing basis. And pretty soon you have a loop that continues to go ongoing. So here's what we're going to do. Let's walk through this just a little bit, okay? When it comes to your emotional problems, your emotional stuff, pretty soon we end up I'm going to use the word having our stories about our own life. A story, if you've ever been around me, is called an excuse. I can't do this because something happened way back in the day, and that's that, and it's been with me all this time, and I just haven't been able to heal from it, and so I really don't want to try it, because if I do that, it's going to get progressively worse, and then I'll never be able to do anything. Or, as we said before, let's say that you're in a relationship, and all of a sudden things go bad. You don't go in agreement anymore. You're not growing together anymore. That intimacy, we don't want to confront it. We just don't want to touch that other person anymore, right? Oh, I can't. My back bothers me. It just hurts too much to do that. I can't get it done. My erectile dysfunction, is bad because it's positional. Think about that for a second. Is it really? Or is that your story that's giving you an excuse not to engage emotionally? Now, when you join us on the 14th of this month, Dr. Browning and I are going to get into the neurological platform. We're going to get into the biochemistry of this stuff. And because back pain is back pain, it affects the majority of the world at one time or the other. 40% of all the population has got chronic back pain. Now, where's that chronic back pain coming from? Is it because they have a paid-for belly that they're not getting in shape and tightening up so they can protect themselves? That core that we all talk about? Is it because we eat like garbage? And, sugars, the sodas, the coffee, the black teas, the fast food, the fried foods, the alcohol, the gluten, the additives, the preservatives, the GMO products? You know my mantra. Because they cause inflammatory reactions that cause tissue to swell. Is it because the structural components of the body are misaligned? And we're walking around in a bad postural pattern. The spine is out of position. Or simply, is it because we're burying something deep inside that sooner or later will become physiologically manifested as a structural problem? But it's important that you understand that in all situations, that you can resolve the majority of this stuff. You can turn it around. You can make things better if you're willing to deal with it. There's a lot of different techniques, if you will, out there. Something called neuroemotional technique. It came out of the world of applied kinesiology. A guy by the name of Scott Walker was the one that put the pieces together. There's things like emotional freedom technique, and it goes on. There's a lot of different pieces of that puzzle. But you can also look at the energetic platform and the disruption that takes place in the neurochemistry that's causing the stress patterns. But one perpetuates the other. One feeds on the other. And I'm going to show you how to turn that around. I'm going to show you how to fix that. And it's not going to be that you're going to sit and you're going to have to, spend 20 years with a psychologist. Maybe it's learning how to recognize that certain things have happened. I said on WMAL a little while ago that I was at a conference about a week ago or so, and somebody who I have a tremendous amount of respect, she has a real niche in the emotional side of the platform. And she said, "Come on, Tom." She said, I want to treat you. I said, "Okay, let's get it done." So I like having people put their hands on me so I can see different processes and how they unfold certain things and how they make things happen. And she worked with me. She says, "Hey, I'm picking something up." And, she's muscle testing. She says, "What happened when you were about 3 years old?" I said, "What are you talking about when I was 3 years old?" I said, "Nothing. I had a great life. My life was wonderful. I grew up in a Sicilian Roman Catholic community, great people, conversations at very, very high levels, and then they calmed down afterwards." And I said, "Nothing." And then all of a sudden I thought about something I hadn't thought about in years. I went to kindergarten 2 years in a row, not because I flunked out, but because when I went at 4 years old, my grandparents, because I lived with them during the day so my mother could work, apparently I was a pain in the butt. And so they got me to go to, they went up the street, the Roman Catholic school, and they got my, the mother superior to say yes. And so I spent 2 years, and she looked at me and she said, "How'd that make you feel?" And I said, "Not enough." She says, "Wow." She said, "I'd never known that." I said, "Yeah, well, that was an issue for some years when I was younger, and I probably went over the top in many ways just to try to resolve it." Interesting, right? Very interesting. So here's the deal: you can reverse anything. You can make anything happen. We are a electromagnetic, biochemical, neurological, emotional platform. You have to treat all of those sides. All of those sides. Remember my book, Ageless Health. Health is a do-it-yourself program, right? It lays it out. It lays the structural, chemical, emotional side. If you don't have a copy, get a copy, pick it up, and see if it makes sense to you. And also send me notes. I'll respond to you. Just go to drtomroselle.com and send me a note. We'll get back and forth, and we'll see what we can do to make it happen. But join us on the 14th. Go to rosellcare.com or drtomroselle.com. Register for the class, and I'll make it really interesting for you. We'll have some fun with it. I promise you we'll have some fun with it. But in the meantime, go to my website. Go to drtomroselle.com. Go to Ageless Health Store. And if you go down to Ageless Health Store, there's going to be a vendor that we really enjoy. It's Lotus Whey, LOTUSWEI. And it says flower essence infused aura mist by Lotus Whey. So go ahead and click for more information. And there's going to be an ongoing presence there that's going to walk you through, show you some of these things. But this has to do with the emotional side of healing. And I promise you that you're going to be amazed at what can be done just with flowers, the things that God gave us, beautiful flowers. And you can make a huge difference. So check that out. And if you got some immediate problems, back pain, there's BioFreeze, which you can apply to any muscle and low back and so forth, and that works. And if you want to soak it, there's Dead Sea salts, right, from the Middle East, from the Dead Sea. And it'll pull the inflammatory levels out. What you do is you get 3/4 of a cup of Dead Sea salt, put it in a bathtub, and soak for about a half hour. And then always Tremel, which works beautifully. We had that by the caseload when my kids were growing up. We always had it available because it was important that we could, get the pain out real quickly. But anyway, join me. I'm looking forward to seeing you on the 14th. It'll be a great evening. Dr. Browning is amazing. I always learn from him, and we've been together 23 years. He's an incredible human being. August 14th, 6 p.m. at the Roselle Center for Healing in Fairfax. Send me any kind of question that you have beforehand. I'll get back to you, I promise you. drtomroselle.com. Having said that, I hope you enjoy these programs. And if there's anything that I can do to make them better for you, something that would, help you really optimize your health, put it in your hands so you have control, let me know what that is, and I'll make sure that it happens. Having said that, you have a great day. And remember, I do this only for one reason. I love you all. See you later. Bye.